Well, good afternoon, everybody. I'm glad you could join us. So if you are joining as a participant, you're welcome to introduce yourselves in the chat. We're going to wait just a moment so folks can log on, and then we will get started. Okay, so I think we'll go ahead and get started. So welcome. Happy Friday. Good afternoon. My name is Allison Foster. I'm the Executive Secretary for Delta Mega, which is the Honorary Society for Public Health. We've been around for over 100 years, recognizing excellence, teaching, and practice and service in public health. So for the past couple of years, Delta Mega has been hosting a professional development series for early career professionals. And our presenters are always faculty and practitioners who are affiliated with Delta Mega chapters. This year's theme has been communications, which of course is an incredibly important skill set for public health. And we have webinars running all through the year. So very happy to introduce the presenters for today, Alyce Palko and Jeannine McMillan. And I'm going to ask them in just one moment to introduce themselves. They're going to go through their presentation. If you have questions during the webinar, please type them into the chat or the question and answer feature you should have on your Zoom, and then we will answer them all at the end. So give me one moment. I'm going to start recording the webinar. All right. Well, I'll go ahead and turn it over to my colleagues now. Thank you very much.
Thank you so much, Allison. Hello, everyone. My name is Alyce Palko. I am a Delta Omega inductee as of 2023 and a graduate of the University of Pittsburgh School of Public Health. I now work for Pitt's Clinical and Translational Science Institute, and I'm so glad to be here today with my co-presenter, Jeannine. I will allow her to introduce herself and start us off.
That's great. Good afternoon, everyone. Thanks, Alyce. My name's Jeannine McMillan. I'm with the Center for Population Health. We are located in Johnstown, Pennsylvania. We cover a 2-county region in Cambria and Somerset County. So for those of you that are familiar with this part of the state, we're about halfway between Pitt and Penn State. So depending on where your allegiance lies with those teams, we are physically here in the Allegheny Mountains in between both of those areas. So a little bit about the Center for Population Health. We were founded almost 10 years ago now through support from the 1889 Foundation, a local philanthropic organization that was born out of the acquisition of our local health system by a for-profit entity. And so they had created the center really with the idea of forming a collaborative research and resource center, really focused on all things population health and disease prevention to benefit those individuals in our 2-county region I mentioned. Our mission and vision you can see on the screen there, improving health through collaboration, outreach, and education, and our vision of an empowered community where all people have access to equitable health opportunities. Next slide. So just a brief background as we think about public health communication, particularly in the rural communities in Cambria and Somerset County. Wanted to give you a little bit of a highlight of some of the socioeconomics, demographics in our region. And Cambria and Somerset County, very similar counties. We're really considered sister counties. Many of our health and human service organizations serve individuals in both of those counties. And so you're going to see a very similar story in both of these slides here. We have had in both counties significant population decline. You can see there in 2000, about 152,000 individuals in Cambria County, and in the 2020 census, a decrease to about 133,000 individuals. So what does that mean from a community standpoint and a public health standpoint? Less workforce, and we do have a significant issue with blight. A lot of vacant homes in our region. A lot of individuals have moved out of the community as well. An aging population, about 23%, a little over 23% of our population are over the age of 65, and we know that translates to increased needs of care for those individuals, and as I mentioned, less workforce to take care of them. Declining incomes in both counties. We have in Cambria County about 46% of the individuals living on less than $50,000 annually. And then from a payer perspective, we do have about 26% of individuals who rely on Medicaid, 23% on Medicare, and about 6% of the population in Cambria County who are uninsured, a little bit higher in Somerset County. This really translates to significant impact on local health care and human services for individuals who have again, from a coverage perspective, 6% who are uninsured, and from a Medicaid perspective, we know Medicaid and Medicare lower reimbursement rates than commercial plans for health systems who are really struggling in our communities to continue providing the levels of care that they have in the past. Next slide. Somerset County, again, very similar story here as well. As I mentioned, the significant population decline, about a 7% decline in the past 20 plus years. Very similar aging populations and declining income, and about 8% of the individuals in Somerset County being uninsured as well. Next slide. So every 3 years, we do help to coordinate the community health needs assessment with many of our community partners, our health system, the local United Way, our foundations. In 2025, we had our most recent community health needs assessment and identified the 5 priority areas on the screen there as those areas to focus on over the next 3 years. So you can see, and I don't think this will be any surprise to any of the folks on the call today, by the community health needs assessment, by surveying and focus grouping our community members, as well as looking at the public health data available, we've identified mental and behavioral health, access to social drivers of health, so looking at food, housing, transportation, and safety. Under physical health, we know, again, as we talked about our aging population, some of the challenges that come from those aging individuals: cancer, diabetes, heart disease, stroke. We know women's health is a priority need as well, and then access to affordable healthcare and medication, all under that physical health umbrella. The last 2 priority needs that were identified: substance use disorder and early childhood. So again, as we go through the presentation and we talk a little bit about ways that we are looking at communicating to our rural populations, this community health needs assessment exercise is just absolutely essential in identifying, getting that voice of the community and identifying what those priority areas are that we should collectively be focusing on. Next slide. So through that process, we're able to not only look at priority focus areas for our community at large, but also for the Center for Population Health's work. And you can see some of the major initiatives underway currently at the center include our community health worker program. And I'll talk a little bit about several of these in a moment. But we have our community health worker program, which is our community care hub. It launched back in 2020 and is the first community health worker program in our region. Social drivers of health initiatives. Again, we have major initiatives around food insecurity, working with our community partners on housing stability, transportation, and many other areas under that umbrella as well. We're also working to address clinical care gaps, again, including physical health, mental health, dental, and I'll talk about a very exciting dental initiative that we're working on with the University of Pittsburgh as well. education and community outreach regarding healthy living and activity. We work very closely with our housing authorities, area agencies on aging, libraries, and our churches. Again, really from a grassroots standpoint, and then on the theme of the presentation, really how we're connecting with some of those grassroots agencies in the community to get this information out to our most vulnerable residents. We also do a lot around policy advocacy, addressing those community public health needs. So whether it's meeting with our local mayors, county commissioners, or state and federal representatives, really ensuring that we're bringing the voices of those individuals in our community to the forefront, sharing their stories that they're sharing with us to highlight really some of those challenges that we're seeing. And then our health data analysis, again, including the coordination of the community health needs assessment, is an incredible way to get that voice of our customers, if you will, our community members, in order to identify opportunities for improvement and ways that we can share with them those resources available. Next slide. So again, in thinking about ways that we are translating our programming into, those community-facing communication efforts, I mentioned our community health worker program. Many of you, I'm sure, are aware of the rock star workforce that are community health workers, but if you're not, community health workers are frontline individuals in a community. They are ideally from the communities that they're serving, and they themselves may have had lived experience that they're able to bring to the table. And when they're meeting with our most vulnerable at-risk residents, they can really sit face to face, eye to eye with them and share their stories and how they may have been supported by a community agency in the past, or they themselves may have been able to bring themselves out of poverty or address a chronic condition. And so, we are just, again, thrilled to not only be able to bring our program to the community, but see it grow significantly over the past 6 years now that since we launched, that I think is very indicative of the needs that we're seeing in the community, the fact that this program has been able to grow. We follow a national model called the Pathways Community Hub model. It brings a coordinated approach to that care coordination that the community health workers are doing. And you can see here on the screen, our community care hub is really a network of what we call care coordination agencies. So these are agencies that are trusted in the community who agree to hire the community health workers and connect them to at-risk individuals in our community so that they can help to assess their needs through a standardized process and provide resource connections that those individuals may not have otherwise had. So again, when we think about rural communications, the community health workers are just such a great example of individuals. Again, they're from the communities that they serve. So they're those trusted messengers. They're neighbors that are telling folks that, what resources that are available, bringing those to the table and helping to connect folks to those resources and help to, again, address some of those challenges that they may be having. Next slide. Another one of our major initiatives is around food insecurity and education. We are so excited to see, again, this program grow. And again, I think it's very indicative of what we're seeing in many communities across the Commonwealth and across the country with food insecurity. Many of the feedback that we've gotten from our community, again, whether it's the community health needs assessment or individuals reaching out to food pantries or to those community-based organizations that we partner with, challenges in our rural communities with food deserts and decreases in SNAP funding have really, and just general inflation have really taken its toll on many of our rural communities. So our community food initiative really tries to look at it from a holistic approach. How do we, again, bring resources to individuals, but also give them the tools that they need to address some of those challenges? One of those initiatives is our community garden expansion. This program has really just significantly grown, and we've seen such a positive impact from this as well. The picture there on the screen shows Nan McNinney on the far right, who is our food systems coordinator, working with a local homeless and victim services shelter called the Women's Help Center in our community to build a community garden. So great way for folks to get out, really, from a mental health standpoint, working in the garden and being able to also address some of those food challenges and eating healthier. We have farm share programs where we're connecting not only those things that are being grown in those community gardens, but promoting farmers markets, the senior vouchers, getting those vouchers out to individuals to be able to use at those farmers markets. We do a lot around outreach and healthy food education. So again, those trusted messengers going out in the community, talking to folks about ways that they can eat healthier and create their own backyard gardens. We also have many initiatives around addressing those food deserts that I talked about in some of our communities. Again, particularly our rural communities have been hit very hard from a food desert perspective. Food pantries and distributions, really, again, really looking at this from a holistic approach under that food umbrella, looking at opportunities where we can help to meet those needs. Next slide. I mentioned a very exciting initiative around dental care. Again, we've seen in many of our rural communities, as well as our urban communities, closures of dental offices, less individuals going into the workforce. But specifically in many of our rural communities, the phenomenon that we've seen is not only the closures of some of those dental offices, but the remaining dental offices not accepting new patients, or particularly not accepting patients with medical assistance. And this has created a huge barrier to oral health care within our two-county region. So 2 years ago now, we reached out to the Pitt Dental School to talk to them about what we were seeing and really looking at ways that we could help to fill that void, particularly in our rural communities. And just by chance, at the same time, they were also looking to implement a rural training program to train dental hygienists and dental assistants in the rural communities where they have their branch campuses, so Titusville, Bradford, and Johnstown. And so we're excited to share that in working with them, we in our local health system, the Conemaugh Health System, a federally qualified health center, Hindman Area Health Center, and our local foundation, many other community partners, will be launching a dental training program in the fall of 2027. We're currently recruiting the first cohort of students for the dental hygienists and dental assistants now, so that they can do those prerequisites over the next year that they'll need for that program. But they anticipate through the dental clinic that they'll be opening that with those dental hygienist assistants and a few dentists that will be doing their training still at Pitt, that they'll be able to treat close to 2,000 individuals annually with that program. So it will be an absolute game changer for rural communities, providing that access to dental care that they unfortunately have not been able to have over the past several years. Next slide. So our education initiative, and again, wanted to give you a little bit of a feel for some of the major programs that we're working on. But when we look at opportunities for communication in our rural communities and sharing of public health information, our education and outreach initiative is really at the forefront of that. So again, looking at opportunities to connect with many of our community-based organizations. We have a very robust health education and outreach initiative that consists of, I think I've lost count, but 30 to 40 health fairs that we either coordinate or are part of within the two-county region. So working in the northern part of Cambria County, we've had community baby showers. We've worked with our senior centers to bring health education. This past weekend, in partnership with our housing authority in Cambria County, brought a Families R Us event with community partners. We were able to bring health and human service agencies to close to 400 people at just one of our housing authority locations. So our community partners have, food and bouncy houses and fun games for the children. And we are able to really rally our health and human service agencies to table at those events to bring much needed information on resources in the community to those that are most at risk and vulnerable. So the health fairs are a great way, again, to get out in the community, really get that feedback. We're holding these health fairs, again, not only with trusted partners in the community, but bringing them out to the communities that we're serving. We know there are transportation barriers for many individuals in our rural counties. So being able to bring those events to those locations is absolutely the best case scenario. So you can see some of the samples of some of the education sessions we've done in the past. Fall premature deaths by way of senior falls are very high in Cambria and Somerset County. You can see here, this is, I think, data from about a year ago now, but it hasn't changed significantly. You can see the data that's on the screen there are the years of life lost for individuals over the age of 70. By premature deaths. So Cambria County, 10,400, Somerset County, 8,900, compared to the Pennsylvania and US averages of 8,000. So when we were able to look at this data and drill down with our local coroner's office to identify that senior falls is one of the biggest drivers of those premature deaths, where we were able to work with our local health system, their trauma team, and do education events, again, with our senior centers, housing authorities in both counties on fall prevention. So looking at ways to decrease that fall risk, educating folks on why you need night lights in your home, why throw rugs aren't the best option for individuals in our tripping hazard. We're able to not only provide those educational sessions, but do lunch and learns, provide those night lights to folks, grip bars, all the things to keep them safe in their homes and hopefully have a significant impact on that data that we're seeing that's showing those premature death rates. Next slide. Policy advocacy, again, another significant opportunity that we see. Again, when we're getting that voice of our community, being able to take that back to, as I mentioned, our county commissioners, city leaders, bringing that community health needs assessment data and the results of those focus groups and those surveys that we are gathering from our community, sharing those with our elected officials and folks from health and human service agencies and associations is really such a great opportunity to get the message out. We know that funding is difficult. We know that we're seeing cuts in services and funding for services. So anywhere where we can really be strategic and sharing those stories is a great opportunity. We've been able to do that over the past year, for example, with regard to local pharmacy closures is a significant barrier. Threats to funding for public transportation is another area as well. So elevating those firsthand accounts and stories, as well as that public health data, is a great opportunity as well. For those of you, I think maybe in Pennsylvania or even across the country, looking at the rural health transformation plans as an opportunity as well. If you haven't had a chance to look at the Pennsylvania rural health transformation plans, I'd encourage you to do so. We see significant opportunity to elevate the voices of our community with these funding opportunities and looking at how we can best leverage the existing programs in our region in order to address some of these significant challenges. The next slide. I think that this might be yours, Alyce.
Yes. Thank you so much, Jeannine. I I am just constantly amazed by CPH's work and just so grateful for the chance that I've had to be a small part of it through my practicum when I was completing my M.P.H. and as a part of our prior work on a task force to address COVID-19. And so that will be a main component of what I'll share with you all today as a use case example of some targeted communication efforts to reach a community in an emergency situation. And I'll highlight some of the key lessons learned that we generated from this experience reaching these two rural counties. And so Jeannine has already introduced the two counties that were of focus, but here they are on the map of Pennsylvania. And in order to support the populations in these two areas during the early days of the COVID-19 pandemic, the Center for Population Health led and established a task force of local health and human service agencies, community leaders, faith-based organizations, as well as representation from policymakers, even leading up to the State Department of Health, in order to address the pandemic. This effort began in February of 2021, and the task force's focus was on organizing COVID-19 vaccines, testing, mask distribution, as well as information and communication. And that is the latter component I will focus on today in this presentation. The task force facilitated a county-wide COVID-19 action plan via an initiative called the Health Initiative for Rural Pennsylvania grant program, and that was supported through the state's Office of Health as well as the CDC. And at the time, the Center for Population Health was the fiscal agent. We also had a strong partnership with a grassroots organization called In This Together Cambria Somerset, which was put together by local community leaders and academic experts to address community needs through the pandemic. And this represented both counties established in December 2020 with a main focus on promoting COVID-19 awareness and community resources for people so that they knew how to stay healthy. So now I'll dive into some of the prime ways that the task force and ITTCS collaborated to share out messaging about COVID-19 and ways to stay healthy with these communities. One prime way was creating a dedicated website that could include various links to external resources, lists of events, and other key information. And this was created through this partnership. One key area of the website's content was a collection of community member stories to promote COVID-19 preventive behavior, such as wearing a mask. And this began even before vaccination was available to the public, when mask wearing was really the main way, in addition to isolation, of preventing COVID-19 transmission. And as we know, in some communities, such as some rural communities across the U.S., COVID-19 was politicized and it was a very stigmatized topic. Mask wearing could be seen as a difficult behavior to adopt. But through this mechanism, the campaign used individual member stories from people who actually lived in the community to explain their choices for keeping themselves and others healthy as a way to encourage other folks in the community to stay aware and to do the same. There were also resources shared on the website once vaccines started to become available. The task force was a prime partner along with pharmacies and local health clinics in the area to distribute and set up mass vaccination clinics, as well as a home vaccination initiative. We also collaborated on sharing out information about testing locations and other educational resources. And so the website became a main way for people to find information that was local and created by the people actually in their communities. We also had a page listing events. So vaccination clinics were advertised there, as well as resource distribution points. And we included news coverage. And this image is an example showing how there was a collaboration between the task force, local pharmacies, and the Johnstown Juneteenth celebration in 2022 to offer vaccines at the point of a community event. And one of our key partners in this effort would say, you have to make it a party, you have to make it fun. Getting a shot isn't the most fun experience, but if you can bring it to where people already will be, if you can make it easy for them to make that choice and remove some of the barriers, as well as making it part of a fun community celebration, then that can reduce barriers to accessing this resource and also provide a point where community members can get information and actually connect with the health leaders in their community and get their questions answered. This is a prime way that trust can be built and that vaccine hesitancy can be overcome. Even if someone chooses not to get vaccinated that day, that conversation that they have and the observations they make may encourage them to make another choice in the future. And it can be a prime way for that communication to happen. We also had a series of TV and social media, as well as radio announcements as PSAs that we conducted as a way to get the word out about the website so that folks knew they could go and visit it to get information. And so this was a broad effort to share out that information with the community. We included videos as well that were broadcast on a local TV station. We had a really great partnership with them, and they were posted to YouTube and then linked out on the website. These videos were part of a campaign called Staying Aware, and they featured 1-minute informational segments and 30-second commercials that were aired weekly during prime time on television. And they featured local leaders, public health and medical experts, as well as elected officials and community members. So some of the strategies we included here are not just having messaging come from healthcare experts, but also having messaging about staying aware and taking health behaviors to come from other community leaders and trusted messengers, so that we had a very broad group of people sending those messages. And then we used the existing channels that folks were already going to get information in order to reach the broadest audience possible. And all of these linked folks back to our website so that they could find updated information there. In addition to that campaign, we also created a series of print and non-technological media. So that included a series of billboards placed on highways throughout the county, newspaper ads, and a direct mail campaign. We had a particular focus on reaching people of color as well as parents to share targeted and tailored information about vaccination and healthy behaviors. And we also had a really great effort by ITTCS regarding Facebook Live sessions, which served as a Q&A, a way for the community to directly ask questions of medical and health experts. And those were, I believe, at least on one occasion, aired live on television as well to reach a broad audience. I'll now go over some challenges and solutions, because this work was definitely a major challenge to work within a emergent situation with a lot of changing information constantly and a lot of needs that had to be addressed. So the first challenge that we encountered was developing an audience. Since this was a brand new disease and a brand new virus, it was something that was on everyone's minds, but they we're needing to come to a brand new website to share out that information and receive our messages. So our solution for this was that we leveraged the existing audience of the In This Together Cambria website to promote the campaign, and we partnered with other agencies and with our local media who had existing audiences to drive all of the information into these existing channels. to address challenges with project management, since this was a brand new effort that we engaged various organizations within. We had addressed that through the grant funding that provided assistance for communications tasks and the management of this effort. But we want to recognize our volunteers who were really the backbone of this effort as well. And to develop effective messages for a wide variety of audiences with varying levels of acceptance of this type of information, we created those short weekly PSA segments. So that allowed for many frequent messages and flexibility to adapt our messaging over time as we got new information about how the pandemic was changing. And we also utilized a broad multimedia approach with many different types of media to reach people who go to different types of media for their information so that we could meet people where they are. So now I will transition to share a bit about a practical tool that comes out of my current work with the University of Pittsburgh Clinical and Translational Science Institute as a way for anyone who is interested in conducting outreach to a community to plan that outreach so that it is tailored and centers that community's needs and preferences. So this tool is called the Community Engagement in Research Precision Outreach and Planning Tool. You'll note that there is a focus on research, and that's because as an academic center, my work is primarily focused on supporting research efforts that are community engaged, but this tool could have applications for work that is more formative or programmatic in nature. I'll just give a brief overview of the program and the support for this work. So in collaboration between Pitt CTSI and our partner organization, Community Campus Partnerships for Health, we form SEEKR, which is the Community Engagement Alliance Consultative Resource. This is an initiative of the National Institutes of Health Community Engagement Alliance, and we are a national consultative and dissemination resource within the SEAL platform. We translate community engaged research expertise and insights from our consultations with research teams across the country into implementation experience and durable shareable resources. Ultimately, we strive to inform research design and support practice across NIH programs as well as other research work. And our activities and our deliverables are tailored to address science-specific needs, but we also more broadly want to enhance participation within the broader research landscape and support community-engaged research at large. And so our role is to, listen to the needs of research teams in real time and then understand what lessons learned are generalizable that other research teams could apply to their work to make it more community-centered. And then we share those out through tools like the SIRPOP tool. And so this tool, which is now available online for free, you can scan the QR code that is on screen. You can also visit this link that I will put into the chat. And that will take you to the page where you can download the tool. So SEEKR developed this tool primarily to help community-engaged researchers plan more community-centered outreach and overcome challenges with outreach planning. So that instead of approaching outreach just by kind of throwing spaghetti at the wall and hoping that it sticks, researchers might instead be able to plan for outreach that centers the community's specific characteristics so that it might be more effective. And this is a way of helping research teams who really want to engage with communities to partner with them. The tool guides researchers to systematically develop tailored community-centered outreach strategies and communicate with those communities. And we really encourage users of the tool to complete it with community partners. You can certainly view it and use it to start jogging your thinking, but it can be a prime way to support an existing partnership or help you develop a new partnership, say with a community-based organization in a rural community. And this can be applied in the early planning stages of a project all the way through recruitment for a research project or the start of a communications program. And this is primarily intended for those who are new to community engaged research. So if there are any early career practitioners or researchers on the call, this really is for you, but it can be used by anyone at any stage of their career. The tool contains clickable checklists and reflective questions that has fillable text boxes, and that facilitates planning conversations among community partners and research teams. And by filling out the tool, it will help the team to generate a documented, reproducible outreach plan that they can then implement in their project. And that also helps to introduce rigor by centering community priorities and forming the outreach plan around what is most likely to work for a community. And within the tool, you'll find questions about the following domains. So always centering that community that the team intends to outreach and their needs and preferences and contexts. And this tool is really built on the idea that when you've reached out to one community or seen one community, you've just seen one community. It's really necessary to reach out to a specific community and leaders within that area to understand what that particular community wants and needs, and to do that every time when a new initiative is started in a new area. The tool also goes over other domains regarding outreach and communications, such as the delivery mode, so how the information will be delivered, the dose, which in this case would mean the most appropriate level of outreach and communication in total, the best frequency, so how often on a repeated manner is that outreach happening, and then the best time and place to make sure the outreach is specific to the community and what's most accessible to them. I'll now share a use case example of how a research team engaging a rural community might apply this tool to support their work. And so if a research team intends to engage a rural community, they may start out by considering how to plan an outreach strategy that will reach that community appropriately. So they might meet with their community partners and review the tool to complete it together. They will probably need 2 sessions and might want to take a break in between and have those happen a couple days apart to allow enough time for reflection. The academic team might facilitate the session, but the community partner could facilitate as well. And ideally, the community partners, their role is to share their lived experiences that inform the outreach planning, because they are really the folks who know the community and what is going to work best for them. And together, the team will reflect on how to conduct community outreach that centers the community, how they will evaluate that outreach, and then how they might adjust their plans if they start communicating and doing that outreach and they're just not really getting a great response. They can use the tool and what they've reflected on to pivot and adjust. The tool also helps a team to identify action items, and they can use those action items to follow up with their team or other individuals in the community afterward to strengthen that outreach plan. And so we definitely want to hear from you all. So as you access this SIRPOP tool, if you end up implementing it and using it in a project, we would love to hear from you and get your feedback. We strive to make our products as useful and relevant to real world contexts as possible. So we have a feedback form. It is linked on that web page that I posted in the chat, and you can access that to give us some feedback. You may also email us at seeker@pitt.edu with any questions or feedback. I think we'll just close out briefly with some reflections from Jeannine and I, just these last couple of slides, and then we can take some questions. So back to you, Jeannine.
Yeah, thanks, Alyce. And sorry. Yeah, I think just a couple of things. I think from our standpoint, just thinking a little bit about our current work and where we've seen the most effective ways to, to communicate, to get that messaging out. As I mentioned before, the trusted messengers in the community, I can't say enough. And as Alyce was overviewing some of our work during, the pandemic, it seems so long ago, but yet, it seems like it was just yesterday. We really relied heavily for that and a lot of our current work on those trusted messengers, whether they're community health workers, neighbors, folks that are, our public health professionals that are really able to connect with individuals and have those one-on-one conversations. As Alyce said, events like Juneteenth and having the vaccine there, but also in a fun environment. It made it a lot less threatening for folks, but gave them the ability to maybe talk a little bit and warm up to the idea of, vaccination and dispel, any misinformation. So I, again, can't say enough about those trusted messengers in the community and the effectiveness of having those folks. We in our two-county region, the majority of the geography is rural. We do have a more urban area within the city of Johnstown and the city of Somerset, but for the most part, most of our two-county region is, from the tip of Cambria County to the bottom of Somerset County. It's about a 2-hour drive, and a lot of rural small towns within that purview. And what we've seen are a lot of the same challenges, right? There are difficulties with whether it's transportation barriers or food insecurity or lack of healthcare providers, but there are differences from a rural standpoint. We saw a lot of that evidence during the pandemic as well, when a lot of meetings, education, doctor's appointments went virtual. In many of our rural communities, broadband is a huge challenge, so that is not as significant in many of our urban counterparts. So really, again, there are a lot of similarities broadly, but when you get into the communities, seeing those differences, and as Alyce said, not all rural communities are the same. We see so many differences within just pockets of those communities within the two counties. The same, holds true across the Commonwealth. So really getting those voices of the community are so important, so that we can see where those nuances are and plan our communications around what works for every individual community. Alyce, I know that you had the varying modalities being a key, so I'll let you talk about that one. I will say what's been a large part of our success in communicating across our region, really those partnerships. We've seen over the past 10 years, but particularly since the pandemic, community-based clinical partnerships being such an incredible part of the success that we're seeing in our region. Not only, I just can give one example from this morning. We have a community collaborative who are meeting right now to create a more robust response to some of our challenges with the cold weather in the winter, and now we see it now with some of these extreme warm conditions. We do not have a drop-in homeless shelter, so how we can come together to create a more robust support system for our individuals who are housing insecure, to meet those needs when we have those extreme cold weathers and extreme warm situations. We had a meeting this morning with folks in Blair County, our neighboring county, who have a drop-in warming center concept. So how we're figuring out how we can learn from them. But the representation on that committee, from city managers to fire departments to St. Vincent de Paul, Salvation Army, again, really the housing authority, that all hands on deck approach, I think, is really is really occurring for a number of reasons. One, we know resources are finite. We know that there are challenges from a funding perspective, but I think realizing that the more that we all work together, the better we can respond to some of the significant public health challenges that we're seeing in our region. So I think that has had a huge impact on the success of many of those initiatives. We saw it with the COVID-19 task force. At one point, we had 70 organizations that were logging on weekly to help with the communication planning, to help with the planning for those vaccine events, those testing sites. Really, it's been incredible to see that collaboration occurring within our region, and we just see so much more opportunity for that in the future. Alyce?
Thank you so much. Yeah, essentially, just to close it out, communication really is a two-way street. And so oftentimes we think of it as just sending a one-way message that's very broad. And while general messages can have a large impact and a broad reach, sometimes the impact grows even more when those messages are tailored and given through those varying modalities, like Jeannine mentioned. And so ultimately, the way to tailor those messages appropriately is to do it through partnership. Meet with the people who know the community that you're trying to reach if you're not already part of that community, and plan messaging together that addresses community priorities and needs to meet people where they are. That would be my ultimate message. We just have our contact info here, and we're happy to take any questions. Thank you.
Okay, well, that was absolutely fantastic. What a great presentation and what great work you all are doing. So I just want to thank you. So we're going to go ahead and take some questions now with our last few minutes that we have. So go ahead and put them in the Q&A. And if you don't mind, I'm going to ask a question first to both of you. What part of all of this work that you're doing are you the most proud of? You have a lot to be proud of. So I'm wondering which part of this stands out.
That's a great question. I can start us off. I would say it's been very fulfilling to me to serve a community that I grew up in, and that had that part of the work has meant the most to me, to be able to connect with other leaders in the community and to do something that I know is really truly meaningful.
And before I say on a personal note what's been, I guess maybe the thing I'm most proud of, I would also like to add that, when you think about the trusted messengers in the community, Alyce probably would not want me sharing this, but during, the COVID response efforts, she and her mother, who is a clinical practitioner, were out in the community going into homes, working with our local free clinic to provide vaccinations to folks who were homebound. So Alyce, you share your expertise and your professional experiences, but you are definitely somebody who, walks the walk and talks the talk out there, really doing that grassroots outreach. And it's evident, your love for the communities that you grew up in and lived in comes through loud and clear. So it was again a privilege to work with you during that time and beyond. And I think for me, just seeing that those collaborations occur over the past several years, that I've been with the center now for 7 years, but I've worked in public health for over 20, almost 25 now, and really just seeing some of those barriers break down and really seeing the collaboration that's occurring in our community, I think, again, has really had such a significant impact. We are so grateful for so many of the agencies that we've been privileged to collaborate with, bring new programming, grow existing programming with, and really just excited about the impact that we're seeing, the positive impact that we're seeing in communities that have had significant challenges from a health and human services standpoint. So I'm looking forward to what we can all accomplish together over the next 10 years.
Great. Okay, so we do have a question. You mentioned the fact that some rural communities don't have broadband internet access, and it varies and it's spotty depending on where you are in the rural community. So the question is, how do you know how to reach people and when the use of certain kinds of technology is appropriate? How do you make that decision if you don't know about their access to internet?
Yeah, that's a great question. It really comes down to talking with leaders who are available in the community who can tell you more about the lived experience of those in the community. And if you really don't have connections to those leaders, like that would be the place to start before sending a message. That way, it's going to land well, with the larger population. And that's where you can really use the SIRPOP tool. It has a specific section for delivery mode with some considerations of different types of delivery modes that might or might not be applicable. And you could bring that to the community partner and say, in your community, which of these would work best? Do people have access to these types of channels? Do they show up? How often do people use social media, if at all? Or do we need to be, hitting the pavement and going to community events and using flyers and mail to reach people? So that starting with that partnership, asking people who do know is the way to prepare.
Great. Okay. Well, again, thank you so much. We're at time, so we're going to go ahead and wrap this up. But we will be we have recorded this and we'll be posting it on our website. And for those of you that joined us today, please keep in mind we've got another webinar coming up. The next one's on September 16th. It's on presenting at a scientific conference. So thank you all and hope you all have a wonderful weekend. Take care.
Thanks.